Individuals with autism sometimes have difficulty in that abstract thinking. That's why we can't use that cognitive structuring as it is we are using with other populations. We can make it more concrete. Less emphasis on the verbalization or the just a talk thing. Rather, we can make it more concrete with examples, with visual materials, charts, colors. For example, if I'm talking to an individual with anxiety, okay, you have how much anxiety, how much you are suffering. There, if I try to communicate that way with an individual with autism, it would be at times difficult to express emotion. There we can use some maybe charts. Show me how much it is. So what we are trying to do, the same process we are delivering, but the delivery would be different.
Hello, everyone, and welcome back to the India Autism Center podcast, your space for meaningful conversations about innovative solutions, scientific insights, and powerful stories. I'm your host, Sakhi Singhi, and I'm so happy to have you here today because today we'll be talking about the power of cognitive behavior therapy, particularly how it's used to support individuals with autism spectrum. And joining us today is none other than Dr. Sushmita Haldar. She's the professor of psychology and dean of arts and sciences of St. Xavier's University, Kolkata. Dr. Haldar is a licensed clinical psychologist with over 17 years of experience in CBT, particularly in clinical and neuropsychology. She's made significant contributions to the field with over 100 publications and is an executive committee member of the Indian Association of Cognitive Behavior Therapy. Dr. Haldar, it's such a pleasure to have you here today. Thank you so much for joining us, and I can't wait to delve into this conversation with you.
Thank you, Sakhi. First of all, it's I would say it's my honor and privilege to be here because I know that how Indian Autism Center is working like for past years. So I really congratulate you, and it is my privilege to be here and talking about this issue. So
Thank you so much, ma'am. So to start, cognitive behavior therapy, it's something that is known, but also something that people don't quite have much of an idea of. How does it apply specifically to individuals with autism? And just generally, if you can give me a brief on what is CBT exactly. I've heard this name thrown around a lot, like in therapy, on apps. So what is it?
So if I talk about first in general about cognitive behavior therapy, and I think even people should know, those who are working in the mental health domain, as well as even that common people should know about that cognitive behavior therapy, because it is a widely used and very standardized practice of therapy. So very simple way, if I try to explain what cognitive behavior therapy is, it is a very structured evidence-based therapy, which is like we found that it is very effective in conditions like anxiety, depression, and many other mental health conditions. And here what we do generally, we try to modify the unhelpful or the negative thought process of the individual to change their behavior. Because the main understanding or assumptions of cognitive behavior therapy is how we behave determined by how we think. So rather than just changing the behavior or simply saying that don't do this, if we can change that thought process or thought pattern, it would be much helpful and it would be long lasting. So this is about cognitive behavior therapy, and it is applicable in many conditions. Even I say now we are working on the applicability of CBT in general health conditions also. Now coming to the autism, like individuals with autism or autism spectrum disorder, there is still that hesitancy and the misconception about whether CBT would be applicable to autism spectrum disorder or not. Because as I already mentioned, that CBT is all about changing the thought process, cognition. So whether it would be suitable or not. So I can tell you that yes, it is very much applicable in this group of disorder like autism spectrum disorder across the ages. But definitely, as we know, they have some challenges and difficulties in processing emotion and thought process. Also, somehow it is a bit rigid at times. Not for all, but it is a general nature. So we need to adopt it properly We need to modify the techniques and we need to make it suitable for them. But I can say it is very much applicable and effective for autism spectrum disorder.
Hello, everyone, and thank you so much for tuning in. I really hope you're enjoying this conversation, and do subscribe to our channel. It'll really help us to stay connected. You know, at India Autism Center, we're building this unique ecosystem. Our residential program, Samavesh, provides lifelong care to individuals with autism and other related conditions. Our training academy, Manan, is set out to create jobs for those interested in caregiving. And our research department, Khoj, is set out as well to collaborate with professionals and like minded organizations to really revolutionize autism research. If you're interested to be a part of this resolute community, please do reach out to us because we are interested to get in touch with you. So feel free to drop in a note either on the comments or reach out to us on info@indiaautismcenter.org or check us out at our website, which is indiaautismcenter.org. See you. Got it. Which actually ties into my next question, which is about, are there any specific techniques which you have found effective or that you know have worked when working with the population that has autism and that is trying to seek support through CBT?
Yeah, let me tell you that, as I already said, and it is will be in the continuation only, that we need to modify, we need to adapt. Is that what we are learning as CBT from the textbook or from, from the training? If we try to apply as it is, then it would not be effective because we have to understand the population, their problems, their difficulties, and accordingly we have to, change. So here I can say technique, if we say that cognitive restructuring is something which is a very core technique of CBT to change the thought process. As I said, that we have to change that negative thought pattern. So to change that, we use that cognitive restructuring process. So here what we have to do, sometimes we find that maybe the individuals with autism, they sometimes have difficulty in that abstraction, that abstract thinking. So that's why we can't use that cognitive structuring as it is we are using with other population. But what we can do, we can make it more concrete and less emphasis on the, verbalization or the just a talk thing. Rather, we can make it more concrete with examples, with visual materials, using more visual materials, metaphors, examples, and using charts, colors. And actually, we do that. Like, for example, if I'm talking to an individual with anxiety, I will just say that, okay, you have how much anxiety you have, how much you are suffering. But there, if I try to communicate that way with an individual with autism, it would be at times difficult to express their emotion. The suffering, but their difficulty in the expression. There we can use some maybe charts. Show me how much it is. Just one example. So what we are trying to do, the same process we are delivering, but the delivery would be different. So I would say again, less emphasis on the verbal communication, more on the other, like visual processing, like some kind of role play and these things that we can apply.
Got it. Ma'am, you mentioned anxiety, that is something that I think everyone to a large degree has.
Yeah.
How is it that CBT in general can help with anxiety? Just asking for a friend.
Yeah, I know. So CBT is very effective. Let me tell you first, CBT is very effective for all anxiety spectrum disorder. You name it, generalized anxiety, panic, which is very common, it is very effective. Because if you know that, again, very briefly, I'll tell you that anxiety is basically what is that? It is that apprehension that something bad will happen, something will happen. If it happens, some kind of thought. So now you understand it's all about thought process, that I'm apprehending. So what we do when we start the CBT, first we try to understand why, how these thoughts, kind of generated. What is we don't need to go like the back, like childhood or something, just to trace back those thought processes, how it generated. And then we modify those thought processes two ways. Here we use some relaxation techniques also, because anxiety is having some physical symptoms. That also we need to take care of along with the medication. So some relaxation techniques, and then we change those thought process. Like if you think, sometimes, just I can give you an example, as you were saying that about your friend, so I can talk about one of my friend also, that anything happens, it could be a promotion to a family crisis. Anything he, he comes to know, first is what will happen, how I will manage. That is his expression. So when I talk to him, forget about CBT, normally also, I just tell him maximum what can happen. So that is, I'm giving you a daily life example. But for CBT, exactly we do same thing, but in a more structured way. We target those thoughts to change those, I would say, distorted thought process,
Yeah.
which is, causing those anxiety. And and that's the way we manage
Is
anxiety.
CBT something, ma'am, that can be done, that can be self-regulated almost? Is that possible?
I would say that is in there. Very good thing. Like it is actually self-monitoring is a phase or a technique in CBT we use also. But as I said, that we should start with that identifying those unhelpful thinking, distorted thoughts. We try to modify the therapist, and then along with this, definitely we need that self-monitoring. I'm helping the client to recognize those first, and I'm helping them to uh, to change from those unhelpful thoughts to the positive ones. Then definitely it is the self monitoring in different phases. Like we give them the homework, that tell me in the next session what kind of thoughts you had, you could change it or not. Give me the feedback. And if it is like a more of exercise, isn't
Got
it?
it.
Then we say practice this way. And that's the way. So definitely self-monitoring is something which is an integral part of CBT process.
So I have a few autistic friends and who take therapy, and CBT has helped them hugely
Yeah.
in therapy. There have, of course, been professionals that they've gone to who practice CBT, but they have not been very effective. But there have been professionals that they've gone to also who have had CBT experience that they have found extremely helpful. My question to you is, so I was actually watching a reel the other day, and this was a psychologist. It was one of those passing reels, who was rating different therapies for anxiety. And there was like gestalt therapy, then there
Yeah.
was some other 3-4 other therapies. But she ranked CBT as one of the lowest.
Surprising.
So, yeah, she ranked CBT as one of the lowest. And CBT is something that I have also taken, something that I know my friends have taken. It's really helped. Um, in your experience, do you think that there is something maybe that is better than CBT when it comes to anxiety? Something more that can be explored for people that are facing?
First, let me tell you about that presentation in the reel as the lowest. Definitely, I'm not defending CBT, but I should, give you the scientific evidence also. So it is not me saying or you saying or someone is saying that it is there are a lot of research evidence.
Yes.
And WHO also accepted or just like presented that it is a gold standard treatment. And when we say gold standard means it is based on a lot of research evidence. So CBT for anxiety, even for depression, it is a gold standard treatment. It found efficacy as found. So definitely I'm not agreeing with the point that it is coming lowest. Now coming to your point, so I will stick to the point CBT is the kind of best mode of psychotherapy for anxiety, depression, and other mental health conditions. I do practice CBT also. But at the same time, if you say whether the CBT is the only technique, definitely not. Even as I said that I practice CBT still, when I talk to the individual, maybe CBT format I follow, but I have to use many other techniques along with that. We should not be that rigid that it has to be CBT. With CBT, behavioral techniques come. Also, I start with the psychoeducation, motivational counseling, supportive psychotherapy, supportive counseling, family, involving the family, with the children involving the parent, those are parental counseling. So definitely it's not only CBT, but CBT framework we can use, and we can modify according to the need of the client. In the situation, we have to understand the condition, the background, but still CBT
So
is much
CBT is not
effective.
like a one size fits all solution. It has
Definitely not, definitely not. And when you say that, you just inform that few are found it effective, some of your autistic, like
yeah,
the
friends.
friends, like with the diagnosis, and some are not. I rather would say it is not the problem with the CBT. It is the problem
With the practitioner.
with the probably those who are delivering. So you have to be really, really, I would say three things always. It is the knowledge, your experience, your expertise. Everything should come. It's not only that I know CBT from the books, that you need to know that how to apply. So then it would be effective, highly effective.
So, ma'am, you mentioned about psychosocial education,
Mhm.
and there are a few parents that I have dealt with in the past that are dealing with severe denial about their child's diagnosis. Um, how can these challenges really be addressed by a therapist to a caregiver? Like, how would denial? I'm sure that there might be viewers who'd really help knowing how to process this.
You know, Sakhi, you know better than me that still the problem is more than psychotherapy. It is about the awareness and the stigma. That still we are, it's our biggest challenge. And we are I say that every talk, every seminar, every conference, we start with this, that our challenges is removing those stigma, battling with the stigma, and that developing the awareness. So here comes the psychoeducation. Psychoeducation, I don't think it is only a clinic based thing. Psychoeducation means educating the client about the problem,
Yeah.
educating the family, educating the caregiver, and educating the society at large. And here, psychoeducation means providing the right information. Sometimes we will say talking about mental health. Talking about mental health is not enough. Providing the right information is important. So that is psychoeducation. Psychoeducation includes those that about the problem, what are the symptoms, impact of it, and not just as like some problem. If say ADHD, we have some notion, anxiety, we have some specific notion, autism, we think it is only about some odd behavior or something.
Yeah.
So that's why I say educating the client about the right symptoms. For that, you need not to be deliver or to understand always the scientific information. It can be presented in a very simple way, but people should understand that as the medical health conditions, we know what diabetes is, what thyroid problem is. So why we will only say mental health issues? Why we would not understand
The
that there is a
diagnosis.
difference between anxiety, depression, autism, and ADHD? So that's my point, that psychoeducation is, and as you asked me about the denial, denial comes, I believe, from the very deep core, that if you have less information, you feel again that apprehension, you feel fearful what will happen if it is autistic. When the parents come to us, maybe some symptoms, some autism has seen or somebody said, so first question they ask, ma'am, what will happen if he is diagnosed with autism? So you understand it's more than the treatment or anything, their fear about the diagnosis. Then I start talking, and then the psychoeducation comes. So denial we can address with right kind of information if we can provide the way we are doing.
Yeah.
It's not a very scientific discussion, but if that people understand the differences and having that knowledge about the problems, then I think denial may go down.
Got it. Thank you so much for that. I think that was extremely useful. That if we are so okay with getting medical diagnosis about physical things, then why are we so anxious about getting mental diagnosis
Yeah.
about our own mental conditions? So I can imagine how important it is to adjust approaches based on these
Mhm.
challenges. And you had mentioned about cognitive distortions. how do these distortions, can you explain to me what exactly is a cognitive
Yeah,
distortion
sure. So
with an example?
cognitive distortion is something like, as I said, that we target that cognitive thoughts, unhelpful thoughts. I say it in a simple way. That is that when someone is thinking in a certain pattern, like if I always feel that if I go to this teacher, she will scold me just based on one experience. But now I started thinking, whenever I'll go, she'll scold me. And I'm not addressing this issue. I'm not logically thinking. I'm not trying to find out the evidence. Most of us do. We all have cognitive distortions of some amount. So now, if with this, it is now, if it is continuing and if it is developing like this, to like whoever, whatever like situation, teachers always scold. So now now my thought pattern is changing. So that pattern is distorted. It is not in, I would not say it is always realistic. It will not happen. Not all teachers are always scolding. And maybe for that particular teacher also, it is once, not every time. So my distorted thought is that if I face this teacher, I will get scolding. So what I will do, what would be my like behavior? I will avoid that teacher,
Yes.
isn't it? So now you understand just of one experience, my thought process. I'm not challenging my thought process. So I developed a pattern of thought, and then it is that my behavior is like kind of determined by those thoughts. Simple way. One, like a student, actually it's again a student example of a real life example. Once like she got stuck into the elevator.
I have that problem. I have that problem. I'm very scared of elevators. So I'll never take an elevator again.
Elevator. So exactly her. So there, but elevator, if I talk to you now also, do you think elevator is something whenever you will go, something will happen stuck or you will get choked or panic?
I'm a bad example, ma'am. I have a really huge problem, a history with elevators.
So we will talk about it later.
Yes.
Definitely. But here saying these things, then the logic doesn't work. And this pattern that something will happen. But we understand it can't be. So this kind of thoughts we call that, name that cognitive distortion. When one particular thought is developed in a as a pattern of negative thoughts. And
Are
it
there
is
different types of cognitive distortions?
Yeah.
I know that all or nothing thinking
Yes.
is one.
There's a list of cognitive. I just giving you one example. So it could be many. That this is one that whenever I'll go to the elevator, something will happen. All or none. All or none. You can say that either I'll pass, I'll fail. Something bad. That is means it's a black and white thinking.
Yeah.
Sometimes it is panic. What happens? We call it that catastrophization. Means heartbeat, a problem, some pain.
I'm dying.
I'm going to die. This is catastrophization. Now you understand. This is called cognitive distortion. Why you are thinking like this? So this we identify. So cognitive distortion for behavior, cognitive behavior therapist, they think that for your behavior, some kind of thought process is responsible for your behavior. If it is positive behavior, it is good. But if it is maladaptive, if it is problematic, what kind of thoughts are behind those behavior? So we are trying to change, alternate those, that distortion.
How would a distortion be positively changed? And what can someone expect in maybe a cognitive behavior therapy session?
Yes. So what happens when therapists first identify those thoughts, then as you mentioned that is it only one cognitive distortion or there are many? There are many. Many are there. As I just two we discussed, catastrophization, all or none. So same way there are techniques also that for this particular distortion we may use this kind of thought, and all these techniques as I'm saying this we can call cognitive restructuring.
Okay.
Cognitive restructuring, that way is the core, means we're identifying, and the changing means restructuring those thoughts by using different techniques. And that, like, again, for different conditions, we are using different techniques. And in the session, these are the cognitive therapy, behavior therapy sessions.
So with autism, it brings a lot of social communication and interaction challenges. how can CBT be applied to improve social anxiety in general? Like, what would you think the steps would be?
Yes. So even if for autism, the symptoms and the characteristics or nature of the problem will not change. Only how we will deal with these things.
Correct.
That would be the different. So social anxiety, same thing, apprehension, that would be there. Feeling of anxiety, that would be there. Some kind of thought pattern is there. That's why they are anxious. At the same time, what we will do, we will use the same technique of cognitive restructuring with modifications. Like, as I just had a talk with you, that what is your cognitive distortion you expressed. Here again, as I said, we will not depend much on the verbal communication. If I ask that individual who is diagnosed with autism, that tell me about your mood, tell me about why you were thinking so, it would be difficult for the person to express same his feeling, but expression is different. So what I will do here, I will use, as I said, other modes. Techniques would be similar. I would use the visual modes. I will do the role play. Role play, and this in the conversation which will come out. I will use the metaphors. I will use the storytelling techniques depending on the age. So I remember that I have seen a adolescent actually with autism, high functioning autism, with lot of anxiety, OCD symptom, addiction, digital addiction, everything was there. He used to say he used to avoid the social situations, but he was highly intelligent and social anxiety was there. So I used to ask him that why you do this? Then that was by conversation, but it was nicely come up. Then he said that I know if I go there, everybody will notice me because of my odd behavior. So that's why I avoid. So he understands, but I need to do that cognitive restructuring. That no, it is not always, because I talked to his mother also. So his mom says, no, I'm very careful that I know where to take, where not to take, and my friends, those were actually very supportive, but still he avoids. So for him, it was good that parent is supportive. But see, here also same cognitive restructuring was used. And for our other kid who is 9 years old, I use that role play technique. He used to avoid those, play group, but he needs social communication and interaction.
I was actually wanting to ask you about that. So let's say someone is socially anxious. Isn't it like there are times I remember growing up that my mom would take me to these parties and I did not want to be there, but you had to do what you had to do. So isn't it sometimes for the benefit of the child also to get some time out? So where is it that, meaning, not socializing becomes a concern?
I think not socializing is not a problem, because I am a person who don't socialize. Sometimes I considered as not so social to the antisocial. Now also I don't, do parties and even these things. But for the child, if I say, it's not about pushing him, at the same time not to accept all behavior. In a way, I'm saying, okay, he doesn't like, so let her be. That is also not the right approach. Why I'm telling you? Because either it's her choice, or for the children, mostly some uncomfortable feeling, some discomfort is there. So we need to
tap into that.
Yes, we need to identify the discomfort. Otherwise, he will be socially withdrawn. At our age, we can have a choice to join, not. But for children, it is mostly some discomfort is there that we need to identify. So it is the mix between understanding that and slowly expose, not to drag him or her to to know you have to because of my social kind of prestige or whatever you say. But at the same time, we have to understand, we can't say, okay, it's fine. To both the ways, understanding as well as exposure is something for anxiety, it works actually. So in both the things we have to
it can
do.
actually help alleviate it, right? Because you understand that it wasn't so bad after all.
But at the same time too, we need to talk to the child also why it is not bad. Just taking him for the exposure is not good. What our parents used to do, just expose. But no, exposure with that proper understanding and a bit of discussion. make him or her understand. So that is required.
So this actually brings me to one of our last questions, ma'am, which is about emotional regulations. Regulating emotions is a challenge. I mean, pretty much for everyone, but more so for individuals with autism, because it's seen in a way, the way neurodivergent folks regulate emotion is not seen typical.
Yeah.
And the question that I'm asking you is not so that it is made to look more typical, but just strategies on how to cope emotionally, on emotional regulation that maybe basis the cognitive behavior therapy protocols.
Saki, again, for autism, you have to understand it's not that they don't have the emotion. They have problems in expressing their emotions, so that's a more challenge for for them. For us, as you mentioned rightly, for everybody emotional regulation is a challenge.
Yes.
For us also, isn't it?
Yes.
But at the same time, we do express. Maybe we say, I got angry, I couldn't control, so we have excuses, isn't it? And we rationalize also. But for them, even they express, they can't rationalize, they can't express. So it is their problem in expression, not that feeling the emotion. So what we have to do, we have to connect in the emotional regulation process, or when we say the training, that how to deal with your emotion. Because see, these are the few areas we work on, like not only with their behavioral thing, their social understanding, social communication, not only interaction. Along with that comes that emotional regulation. So we work on that connection between their feeling and the right expression. Again, I would say, not just by talking, what we use here, role play works a lot. If we could have time, I could give you examples at how it works, like very effectively, and it is wonderful when they come out with their expressions. That again, I would say, it is not always about using few cliche examples like birthday party, this, you are going to a social function. Not always that. We have to understand their problem. This child is having problem with interacting. He wants to interact with the classmates, but he can't. Then we just can't, in the session, we can't do the birthday social interaction thing. It's not matching. So we have to understand their emotion regulation means, if you give, that means there is a problem in the emotion, that if you can present that situation, first of all, that emotion will come. Then I'm training that first, just by just typical exercise, if he says that, you will reply this way. So again, more concrete way, I can tell you, control your emotion. For that child with autism or the adolescent, I'll say that how he will express his emotion. So it is the training on the expression first, aligning with his or her inner feelings, and then modulating it. That is the third phase, that I'll teach him or her how to modulate the emotion in the particular situation.
So, ma'am, a lot of adults very late in life have got a diagnosis also.
Yeah.
In fact, a lot of my friends got a diagnosis of autism in their late 20s. And is CBT just something that needs to be practiced during the child and adolescent age, or is it something that can be practiced pretty much any stage of your life?
Actually, on the contrary, CBT is considered as a therapeutic technique for adults. For the child and adolescents, it is sometimes people say, and again the misunderstanding or lack of knowledge is there, that it is not would be very much applicable to the children and adolescents, as they are not cognitively sophisticated. So for your question, it would be very much applicable to the adults. Those who are, as you said, that because now they understand, they face a lot of social situations. So here you don't need to be always indirect, as I said. You don't need to, present those visual materials or that role play always. Maybe you can talk to them directly, isn't it?
Yeah.
So here, definitely the CBT will work rather, I would say, better.
Got it. And in the case of intervention, the idea is that the earlier you provide intervention, the better it is. Is it the
Always.
same with CBT
Always,
also?
always,
Yeah.
always. For any intervention, earlier. That's why we always say early identification, early intervention also. So it is like impact would be better, damage would be less. So it is early intervention would be better for CBT also.
So, ma'am, there is such a huge stigma. I remember in school going to the counselor was like nobody's supposed to go to the counselor. And it was
Yeah.
such a big thing that, oh, she went to the counselor, this and that. I'm seeing a change in that. The other day, I was speaking to a colleague, and she was telling me, my daughter is going to a therapist, and I'm like, wow, that's so nice to hear. But at the other end, also there are parents who are not sure if their children need to be taken to therapy or if their children are asking for it. Are there some signs, ma'am, that you can talk about so that a caregiver knows that this is probably something that they should try out?
So some feel like definitely you understand that situation to condition it would be different. Like if someone is suffering from depression, someone is having self-harm behavior or ADHD, it would be different. But in general, if I say that especially for bad losses, as you talked about the school counselor, I would say that the usual one, they have a pattern of behavior. If there is a sudden change in the behavior, or say the slow change, you are a person who is very extrovert, you are, socially very active. Now suddenly you are withdrawing. Why? So parents should recognize these changes in behavior, and especially like from the students, like changes in the academic behavior also. Grades are deteriorating. So just don't focus on the grades. Just think about what happened. So these are the, like I would say, the academic performance, their overall behavior, their social interaction, their level of interest. Got it. So if there are changes in a very generic way, and say, yeah, other than the specific condition. So if the parents noticed in changes, sudden changes or slow changes, ma'am, for last 6 months is happening. So that is alarming.
So that means it's not a phase.
Not at all. Don't think it's a bit. Even
Even
let
if
me
it
tell
is
you,
a
even
phase.
if it is, what's wrong? That if you just consult a therapist and try to find out, is there anything wrong for our physical problems? We do.
Yeah.
Even something. No, there is no harm if I just visit a doctor. If I just do a ECG.
Yeah.
We talk like this. So why not for these behavioral problems, or I would say that some psychological issues, or many is perfectly fine, but no harm visiting once. So that's what I'm saying, just to clarify.
And as I've seen a lot of therapists also say, reduce anxiety in 15 sessions, in 20 sessions, in 5 sessions. What is your take on that?
I would say more of a, if I say frankly, these are a more of a kind of, Instagram post.
Yeah.
I would say. I teach students that way, that I know you people are into Instagram, but don't learn psychotherapy, psychology, and mental health from Instagram.
That's a really good takeaway. Yeah.
So definitely not. The skills, don't forget that every individual is different. Every condition is different. And when the individual and condition also it is unique. So we have to treat every individual in that special, unique way, be it so-called normal person or a special person or with any condition. It can't be, we just can't say, even after practicing for 20, more than 20 years, I can be sure when client comes to me that how much time it will take in first session, I can't say. So he was saying that he will without saying this in 5 sessions. Definitely not. And this will, I would take this opportunity to say these things also. These things actually make bad impression or that misconception about the psychotherapy, mental health issues. So we should avoid this.
Thank you so much, ma'am. This conversation has been really, really insightful, and you have really debunked a lot for us. There's a lot for us to unpack in this conversation that we've had with Dr. Haldar, and a lot of good insights that she gave. But before we close, ma'am, I have a quick round of rapid fire that I want to play with you. So I'm going to say a statement. You can say truth or false, or even give a short explanation. So my first statement is CBT is equally effective for all individuals with autism, regardless of their functioning level.
I would say it would be false because I would because we need to consider the conditions, especially their developmental as well as cognitive functioning. So in all conditions, if someone want to apply CBT, it would be not this. CBT is effective,
Yeah.
but not in all stages or all levels.
So, my second statement is social communication challenges in individuals with autism can be addressed through CBT without additional interventions.
Again, false, because definitely other supportive techniques is required. As I say, supportive counseling, behavioral techniques, involvement of the parents, those are also part of psychotherapy. So it is not only that social communication training can be, dealt on.
My third statement is CBT for autism typically focuses on modifying behaviors, not on addressing emotional regulation.
It's false. We have to address the emotional regulation, and CBT can address emotional regulation in autism.
Individuals with autism can benefit from CBT exercises like thought challenging, but may require adaptations for better engagement.
Absolutely true. So it is, yes. That's what I'm saying, that it is effective, but with modification.
Got it. And my last statement is CBT is primarily designed to address anxiety and depression in individuals with autism.
Even other problems. So I would say it is definitely for anxiety, depression, but for other problems also, like social skill, emotional regulations. If I say OCD is there, so it is not only for anxiety and depression, it is much more.
Thank you so much, Dr. Haldar, for this enriching conversation. Your expertise has really brought so much value to us. And I hope the viewers have a lot to take away. You know, it goes a really long way when you comment, like, share, and subscribe. So please leave your questions for Dr. Haldar in the comments, and we hope to get them answered by her. Thank you so much, you all, for tuning in. And I hope you found this session extremely insightful. In the meantime, if you want to watch any of the videos, consider liking any of the ones that are popping up on your screen.